So let's talk about what a breast reduction is and what a breast uplift surgery is. These are two distinctly different procedures with the same scar, but it's important to get it right for the right patient. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon, and welcome to the channel. So what is a breast reduction and what kind of patient is suitable for a breast reduction procedure? A breast reduction procedure is largely a functional operation, which means patients who have symptoms associated with the large breasts need to have a form of surgery to help improve the symptoms. And these symptoms are back pain. They have indentation of the bra straps along the shoulders due to the type of bras that are needed to lift the weight of the breast. They can also get infection, or what we call intertrigo, underneath the breast, particularly in the summer. And importantly, it limits them from doing their daily activities. And these are things like running, swimming, exercise, and that further limits them to maintain a healthy weight. There is a significant psychological aspect to it, where people are feeling very self-conscious when they go out in public. There is a lot of attention diverted to their breasts. Now, when we do a breast reduction surgery, the primary goal is to reduce the breast volume. We also reshape the breast, lift the breast base up, and we will, depending on where your nipple is, reposition the nipple as well. So this is a largely functional operation to help improve the symptoms. And yes, there is a cosmetic aspect to this to help improve the position of the breast, reposition the size and the nipples of the breast, so that they are more comfortable aesthetically wearing different types of clothes. Now, in the UK, the guidelines suggest that when we are performing a breast reduction surgery, there are strict criteria, and this includes that you need to have a healthy BMI of less than 27. And this is because patients who have a higher BMI have a significantly higher risk of infection, wound breakdown, which can take months to settle down. To make a difference to the symptoms of the breast, we need to reduce your breast a certain volume. The guidelines have suggested it needs to be about 500 grams off each side. And it ensures that there is enough difference in the weight to improve the symptoms that you've got. Small amounts of breast tissue being removed will not reduce the overall breast weight to improve the symptoms associated with the heavy breast. We also need to make sure that you've had physiotherapy support, particularly when it's come to the symptoms of your back. Now, after your surgery, it is important to correct your posture and ensure that you wear a well-fitted bra for a good 4 to 6 weeks afterwards to help with the healing of the breast reduction. Now, a breast reduction is exactly that. It reduces the breast. It's not an augmentation or in the décolletage region of the breast. So you will have an uplifted breast, but you will not have an implanted, augmented look in the upper pole of the breast. Now, if this is something that you are looking for specifically, you will need to speak to your surgeon about potentially having an implant in this region to give you more fullness. Although the breast reduction will improve the fullness in the upper part of the breast, it's not going to give you an augmented look as you would get if you had implants. Now, what is the difference between a breast reduction and a breast lift? A breast lift, also known as a mastopexy, reshapes the breast and lifts the breast to a higher position. It's ideal for people who are happy with the volume of the breast in a bra. They don't have any symptoms of back pain or bra strap issues and are able to exercise, but are unhappy with the sagginess or the empty breasts that they have, which are positioned lower than what they were in their younger years. So generally ideal for people who have pregnancies and breastfed, who have lost a lot of weight. They're happy with their volume, but they just want some uplift. Now, surgical scarring is similar or the same as a breast reduction. The only difference with a mastopexy or a breast lift is that we do not remove a significant amount of volume. We are tightening the skin, some cases repositioning the fat, but we're not taking a significant amount of fat or breast tissue away from the breast. Similar to a breast reduction, this will not provide you with an augmented look, i.e. fullness in the upper pole of the breast, but what it will do is tighten the volume that you've got and position it in a higher position, giving you a natural uplift, but not necessarily an implanted augmented look. If you wanted to have an implanted augmented look, you would again need to put an implant in to help improve the volume in the upper pole. So I hope that helps you understand the difference between a breast reduction and an uplift. And if you do have any further questions, let us know. Please like and subscribe. Thank you for watching, and hopefully I'll see you in the next video. Bye.